Alright, this is the IO and osseous infusion video. This is a intermediate and a medic skill. This is for administration of medications and fluids. For intermediate, they can only do for a pulseless and apneic patient. They can do adults or pediatric. Medics can do it on a conscious patient, and also pediatric or adult. It's all fair game, but we just have a pediatric mannequin to demonstrate it today. First I'm going to go over the contraindications. The first contraindication is osteomyelitis or cellulitis over the proposed site. Also fracture at or above the proposed site, and previous IO attempted at the proposed site in the last 24 hours. Okay, so I'm going to go over the equipment you need. Well, first is gloves. This is a procedure that has to be as sterile as possible. So you should take all body precautions. Alright, the betadine or alcohol, that should usually be in your IO kit. You're going to need your drill, of course, the needle, and it'll say, based on weight, exactly which one you need to use. And this is the pediatric one. You need a flush and some extension tubing when you first put it in there. If you don't have a saline flush, you can draw it up from the bag. Just take a needle, draw it up directly from the bag, and drop some saline into it. And just kind of attach it to the tubing at first, just so it's all ready. You're going to have your bag ready to go with your tubing primed, all ready to go, and then you're going to have your infusion bag here, pressure infuser, and you got your patient here, and you're going to stabilize the leg as best you can. You can also have someone help you hold the leg, so if you want to hold it up here and maybe have someone hold the ankle, that whatever works, so that the leg's just not flopping around. Take your alcohol prep. And when you choose your site, you're going to palpate along the front, just under the knee. Just going to find the tibial tuberosity, which is just a big bump right under the kneecap. And you're going to go down 2 to 3 centimeters and just over a little bit, so it's a little bit medially. So make sure you do the concentric circles, make sure it's nice and sterile. And get your needle. And it just snaps on, basically. It's really easy. It's like a magnetic thing, so it just goes on there. You don't even have to wrench down on it. Make sure the batteries are good. Alright, and go down at a 90-degree angle. Just get where you're going, and then very gently kind of push down with a little pressure and push on the button. So you'll feel either a pop or you'll feel a loss of resistance, and that's how you know you're in. And once you're flush with the skin, don't go any further. You're in, pretty much. So just take the drill off and just unscrew the needle. And this can be just thrown in a sharps container because it's very sharp. And this probably doesn't need any other stabilization other than just sitting there on the surface of the skin. It's very stable, doesn't need extra, bandaging or stabilization. But you still want to be really careful with that leg and make sure it doesn't flop around, and make sure nobody puts anything on top of it after you've done that. So just attach your extension tubing, and this will be filled with saline, and just kind of push. Make sure this is open. And you're going to meet resistance, and all of a sudden you'll feel like a rush, and it'll just go in, if it's in. If you notice any swelling around the site at this point, then it's not in, and you can just disconnect it. You can either pull it if you have time, or you can just leave it as is, and it'll just stay there and the hospital can take it out. Just again, make sure you don't bump it or anything like that. Just treat it like it was actually paint. So you got your saline flush in, and you can connect your IV tubing. Unclamp everything. Open your tubing, and this flows a lot faster than a normal one would. But in a normal patient, you are going to use your pressure infuser because it will not flow unless you have pressure on that bag. Alright, that just slides in. Just pump it up till it's squeezing, and you notice that it's flowing really, really good. You can probably have it go just as fast as a normal bolus, and it'll work just fine. But you can also titrate it down, so you can actually use your roller clamp. If you want to slow it down a little bit, you can. It's just like a normal IV. So again, just make sure you are really careful after you put it in. Even though it is very stable right now, it can be knocked loose, and you got to be just really, really careful about that, especially in a code situation. So I'm going to do a quick recap here. Indications are patient that cannot get an IV in any other way. There has to be at least one failed IV attempt before you can attempt an IO. For paramedics, it can be a conscious or unconscious patient. For intermediates, it's for a pulseless and apneic patient only. Contraindications: osteomyelitis or cellulitis at the site, fracture at or above the site, or a previous IO attempt in the past 24 hours. Okay. So make sure you have sterile technique. Have the leg stabilized. Can be slightly flexed just to kind of facilitate placement. There are 4 different sites that are permissible in our protocols. You have the proximal tibia, which I just showed, 1 to 3 centimeters below the tibial tuberosity. You also have the distal tibia, which is on the medial malleolus, which would be right down here, 1 to 3 centimeters above that landmark right there. The distal femur, 2 to 4 centimeters above the patella, so right about there. And then you also have the proximal humerus, which is for adults only, and that one is 1 to 3 centimeters below the humeral head on the anterior side. Okay. Most of the time you're going to be putting it in at 90-degree angles. That's just the easy way to do it. Just a steady, gentle pushing motion as you're depressing the drill. You might feel a pop, or you might just feel it meet a loss of resistance. You should inject the saline via syringe to clear out the needle. You can also attempt aspiration of the marrow, but it's not 100% necessary. If the infusion is flowing freely without evidence of infiltration, then you're good. The needle should feel firm in position and stand upright without support. Also, infusion via this route is the same as venous access, and there's no limit to what kind of drugs you can push through it. It's just the same as an IV. If you have to remove the needle, apply pressure to the area for 5 minutes and apply dressing to that area. Most of the time you will probably just leave it. It may cause subcutaneous infiltration, osteomyelitis, or subcutaneous infection, so you have to be really, really careful when you're sterilizing the site, because it is a lot worse to get an infection in a bone than just in the skin. So just be very, very, very careful. And think that is about it.